NADA Research Review and Global Anecdotes. Researchers have noted the following specific physiologic effects associated with acupuncture, as cited in a comprehensive review of the acupuncture literature. It has been reported that acupuncture at traditional points produced effects in electroencephalogram, glomerular filtration rate, blood flow, and respiratory rate, whereas stimulation of control points by acupuncture needles produced little or no appreciable effect. Studies have linked acupuncture to the production of endogenous peptides, such as beta endorphins and metacaphalines. Acupuncture has also been associated with changes in other neurotransmitters, including adrenocorticotropic hormone, cortisone, serotonin, norepinephrine, and dopamine levels. Neuroanatomically, the ear is an elastic plate of connective tissue supplied by various cranial and spinal nerves. The spinal nerves affect organs and systems locally and distally throughout the body. The biopsychosocial model reasons that acupuncture may influence emotional responses and neurobiology through individual and group processes. The effect of needling may be blunted in patients taking substantial quantities of methadone, corticosteroids, and benzodiazepines. Exposure to these substances appears to suppress part of the relaxation effect during treatment, and these patients may have slower responses to treatment. Nevertheless, the NADA protocol can be used to treat secondary addictions in high-dose methadone patients and in patients on benzodiazepine taper to minimize withdrawal symptoms. Whereas the importance of neurotransmitters in addiction is well established, a complete understanding of NADA protocol neuroscience implications is yet to be established. Most studies of evaluating the effectiveness of ear acupuncture have not been placebo-controlled. Knowledgeable researchers have interpreted and designed studies that do not use a placebo control. The placebo control is most appropriate for pharmaceutical research. It is difficult, if not impossible, to apply placebo control standards to social science research. NADA protocol research is best understood as social science research specifically, but it is not used as a standalone treatment. There are no points on the ear or on the body that are truly inactive in the sense of the pharmaceutical sugar pill placebo. A naturalistic study design compared recidivism rates in 3 outpatient and 4 residential addiction treatment programs. The study found that addicts choosing NADA protocol treatment, we don't like the word not, now we use people who use drugs. NADA protocol treatment as outpatients are less likely to relapse in 6 months after discharge than patients who choose residential programs that do not include NADA protocol treatment. 2 controlled clinical trials provide strong support for the NADA protocol as an adjunctive treatment for alcoholics. These studies produce significantly better outcomes in the active group who received the NADA protocol on measures of attendance and self-reported need for alcohol. The control group reported more than twice the number of drinking episodes compared with the active group who received NADA acupuncture. In addition, the control group had twice the number of readmissions during the follow-up period. Available evidence suggests that a substantial cost savings is realized when the NADA protocol is integrated into a comprehensive treatment strategy. Multiple studies published in peer-reviewed journals support the adjunctive use of the NADA protocol for the treatment of heroin, alcohol, and cocaine addiction. Treatment of addiction is associated with lower community psychiatric hospital costs. When the NADA protocol is combined with conventional treatment in a health maintenance organization setting, an additional cost saving is realized. Cost savings were derived from higher program completion rates, increased number of negative urine screens, fewer inpatient rehabilitation days, fewer inpatient psychiatric days, and fewer outpatient detoxification episodes over the course of the treatment. Acupuncture may provide additional treatment in the treatment of depression and anxiety disorders associated with co-occurring addiction disorders. For example, the Department of Veteran Affairs and the Department of Defense evidence-based guideline reports. The evidence is good that acupuncture may be helpful in the treatment of patients with post-traumatic stress disorder. Retrieved from the healthquality.gov guidelines. In his comprehensive literature review, Bemis discusses published qualitative reports, program evaluations, field reports, and news stories that show the value of the NADA protocol as an adjunctive intervention in disaster relief and humanitarian aid intervention for first responders as well as populations affected by violence and trauma. This is abundant documentation by NADA, ADS, and RTs on the anecdotal use of the NADA protocol in disaster relief work that is detailed in the NADA publication guide points. ADA's assisted first responders by providing NADA treatment in the aftermath of the 9/11 World Trade Center's attack and Hurricane Katrina. After the 2011 Joplin, Missouri tornado disaster, 700 treatments were provided to offer relief for treatment trauma, including finding body parts in the debris. Overwhelming positive results were realized with reported benefits, including reduction of physical pain and improved sleep. The prospective research trial measured the effect of NADA acupuncture in 7 common physical and behavioral health symptoms associated with addiction. This was done in a 28-day addiction recovery setting where patients were non-randomized and self-selected. These symptoms were measured on a scale and included body aches, headaches, low energy, cravings, anger, depression, anxiety, and poor concentration. All patients received usual and customary conventional treatment, which included intake assessment, physician physical examinations, nursing and nurse practitioner care, administration of prescription medication, triage to urgent and emergency care when necessary, medical and psychiatric services as needed, educational groups, individual and group counseling, nightly 12-step meetings, dual diagnosis group, aftercare planning, and the option of participating in either NADA protocol or a study hall free time. Patients in the treatment arm received bi-weekly NADA protocol treatments plus the conventional treatment. Those in the treatment arm had statistically significant symptom reduction across all 7 common behavioral health symptom measures. Symptom reduction enhances the ability to benefit from psychosocial aspects of treatment. These results suggest that NADA acupuncture is a simple and inexpensive treatment that may alleviate symptoms that negatively impact recovery in individuals with addiction. Further work needs to include long-term outpatient follow-up with NADA acupuncture to measure outcomes over months to years in community settings. Additional studies should also evaluate the association of improvement in symptoms with severity of illness, course of illness, and reduction in overall cost of care. NADA protocol and state laws. Scope of practice regulations. A network of state laws exist with respect to the practice of NADA protocols by NADA certified ADSs. Some states have no official state guidelines. For example, in Michigan, more than 500 ADs practice under the auspices of the Department of Consumer and Industry Services. This allows ADs with varying backgrounds, including counselors, outreach workers, nurses' aides, social workers, psychologists, physicians, and correctional officers, to provide the NADA protocol with their scope of practice without difficulty or restraint. NADA policies vary widely from state to state. Some are very restrictive, severely limiting who may provide and supervise NADA protocol services. Where direct supervision is required, an ADS's ability to practice is not in reality much better off, because direct supervision requires an expensive physician or acupuncturist to be present on site each time a treatment is given. When supervision is legislated, general supervision is best. General supervision assumes initial review and confirmation of written protocols appropriate for the particular treatment setting. Periodic on-site visits sufficient to assure that the established protocols are being followed, and availability by electronic means to address questions or problems that may arise between visits. Program development thrives when supervision is available at low and no additional cost to the treatment program. In summary, most addiction and other behavioral health programs, because of the nature of the diseases being treated, have meager means and must conserve all the resources they have. The NADA protocol is an evidence-based best practice. With permissible laws or welcoming community standards, it is an affordable service option even for the least resourced programs. Cost of providing the NADA protocols can be minimal when existing staff is used to administer treatment. Materials, acupuncture needles, cotton swabs, cotton balls, hand sanitizer, sharps container are inexpensive and easy to obtain. Thus, by adding the NADA protocol to existing programs, patient outcomes can be improved without incurring any substantial increase in expense. Registered nurses represent the largest group of licensed healthcare professionals in the United States. Their education and extensive training in healthcare would hypothetically have made them ideal candidates to supervise as well as administer NADA protocol treatment. Those of us in harm reduction, unfortunately, have found that nurses can be some of our worst enemies in helping keeping people with addiction alive. So it is not surprising that this country's nurses have not picked up this ball. Unfortunately, many state laws unreasonably restrict practice and supervision of NADA protocol to physicians and to full-body acupuncturists. This precludes many addiction programs from being able to use NADA protocol for the overwhelming number of patients who would have benefited. In many states, government statutes and regulations need to be revised to enable and empower others to provide these needed and life-saving services. They can easily be integrated into any established addiction treatment program, behavioral health program, community settings, integrating medical systems, and settings of disaster and trauma. Hopefully, this country doesn't choose to be the worst in their addiction treatment like they have turned out to be as far as providing maternal care. And it looks like this country is on the same path to be providing the worst standard of care of all civilized countries for people with addiction also.